Hello everyone, this is Stethoside. Today we are talking about dengue and fever. One of the most common viral infections in India. Every year we see lakhs of cases and early recognition literally save lives. So let's break it down. Dengue is a viral infection caused by the dengue virus transmitted by the Aedes mosquito. This mosquito bites during the day, especially early morning and late evening. There are four types of dengue viruses, which means you can get infected more than once. Once the mosquito bites, symptoms usually starts in 4 to 7 days. The early symptoms can be misleading. They feel like flu or viral fever, but dengue has some very specific warning signs you must not ignore. Symptoms of dengue: high grade fever, severe body pain and joint pain, headache, especially behind the eyes, loss of appetite, nausea, vomiting, skin rash after 3 to 4 days, and extreme weakness. But the real danger is when platelet count drops or when plasma leakage begins. These signs indicate severe dengue: persistent vomiting, severe abdominal pain, bleeding from gums, blood in stools or black stool, difficult breathing, sudden drop in BP, restlessness, cold hands and feet, very low urine output. If any of these appear, don't wait and go to the hospital immediately. Why platelet drops? Dengue causes platelet destruction and suppresses bone marrow, but remember, platelet count alone does not decide severity. Fluid leakage and blood pressure are more important. Tests required to usually diagnose dengue: NS1 antigen positive in early days, IMG and IgG antibodies positive later, CBC to check platelets and hematocrit, LFT because dengue often affects the liver. Daily monitoring is essential. Treatment. Treatment is there is no specific antiviral treatment medicine for dengue. Treatment is completely supportive. Plenty of fluids, ORS, coconut water, and soups. Paracetamol for fever. Avoid ibuprofen or diclofenac. Monitor BP, urine output, platelets. Hospital admission if warning signs are present. Do not take painkillers like Brufen, aspirin, or NSAIDs. They increase the bleeding risk. Do platelets need transfusion? Blood or platelet transfusion is needed only when there is an active bleeding or the count drops dangerously with symptoms. Most patients recover without transfusion.